Hello, and welcome back to Ask Your Pain Doc. In this channel, we talk about traditional and alternative treatments for pain. Today, we're going to talk about a very common muscle relaxant and pain medication called Baclofen. Make sure you subscribe to my channel, turn on notifications so you get notified. Let's do it. Baclofen is a prescription medication that is classified as a muscle relaxant. It is used to treat muscle spasm caused by conditions including multiple sclerosis, spinal cord injury, cerebral palsy, or a simple muscle spasm in your neck or your lower back. Baclofen works by acting on the central nervous system or your brain to decrease muscle spasm and tightness. It is thought to work by inhibiting a certain neurotransmitters called GABA-B in the spinal cord, which can lead to reduced muscle spasm. Today we are going to talk only about the oral Baclofen or the pill form of the Baclofen. Unfortunately, there is no intravenous Baclofen. However, there is an intrathecal Baclofen, which we're going to record a completely separate video about that. Baclofen comes in the form of 5, 10 milligrams, and 20 milligrams, usually based on your physician's prescription. It can be once a day, twice a day, or 3 times a day. Unfortunately, like any kind of medication, it has side effects including drowsiness, dizziness, fatigue, nausea, headache, and confusion. If you take it at night, it can help you to sleep. So some of my patients, if they have very severe neck or lower back spasm, I usually give them the Baclofen at night so it can help them with this sleep as well. You should have a conversation if you have any history of sensitivity to Baclofen or any type of reaction to Baclofen. Kidney involvement. Baclofen is primarily excreted by kidneys, and in patients with renal impairment or kidney issue, it can lead to Baclofen toxicity. It's very important to talk to your doctor if you have chronic renal issues. And pregnancy. Baclofen should only use during pregnancy if you have a very long conversation with your doctors about possible side effects of Baclofen. The use of Baclofen during pregnancy is a very complex issue, and the decision to use this medication should be made during your consultation with your healthcare provider. There is really limited studies about the safety of Baclofen during pregnancy, especially in the first trimester. There is some animal study that suggested that high dose of Baclofen can cause birth defect. However, we don't know if this finding, we can correlate that, to human or not. In general, use of Baclofen during pregnancy should be avoided as much as possible, specifically the first trimester. Baclofen is known to be excreted in breast milk, so the safety of its use during breastfeeding is not really well established. As a result, you have to have a conversation with your obstetrician if you're taking Baclofen. Baclofen is a very common muscle relaxant that can be prescribed for severe neck, lower back, or other type of spasm. Patients with multiple sclerosis and spinal cord injury. It's a very relatively safe medications with not very common side effect. Most of the side effects are including sedation and sleepiness. You have to be cautious if you're pregnant. Otherwise, you have to have a conversation with your doctor when you're taking Baclofen. I hope you enjoyed this short video about Baclofen. There's more video about other medical issues and medicines are coming soon. Make sure you click on the subscribe button, turn on notification, make sure you follow my channel, and I will see you all soon.